everyone. Assalamu alaikum. I would like first to thank the organizing committee for their invitation. So today I will be talking about rehabilitation techniques with individuals with spinal cord injury, and more specifically, gait training with exoskeleton. So as you all know, a spinal cord injury is one of the most devastating injury a person can face, not only for them, but also for their loved ones. And as you all know, it is associated with many complications. But what comes to mind first is the muscle weakness or paralysis. This muscle weakness or paralysis may affect the individual's ability to perform functional activities of daily living, such as eating, bathing, dressing, and walking. And the impact of this impairment is highly dependent on the severity and the level of injury. For example, someone with a high tetraplegia will have more difficulties than someone with a low paraplegia. And for most individuals with spinal cord injury, walking is one of the most highly desired goals for both individuals with complete injury and those with incomplete injuries. Walking and standing has been associated with many benefits, such as an increase in standing balance, an improvement in cardiovascular functions, an increase in their fitness level, sleep quality, and overall life satisfaction. No, that's okay. No, thank you. Thanks so much. So physical therapists, when it comes to gait training for individuals with spinal cord injury, usually approach that in two ways. The first one is applying compensatory strategies, and that is basically applying long leg braces on the affected part. Now, that kind of approach results in a non-functional gait pattern, in addition to high level of energy expenditure. And by functional walking, we mean the ability to walk with or without an assisted device safely and sufficiently to carry out mobility-related activities of daily living. The second approach is called the neurocontrol and motor plasticity strategies. And one way to do this is applying body weight supported treadmill training. That kind of training results in a repetitive and intensive task-specific training. It also not limited by the level of injury. It allows for early initiation of gait training and weight-bearing activities, and also results in more coordinated and stepping movements. With the recent development in gait rehabilitation field, exoskeleton have been developed to reduce the load on therapists, to allow for more consistent assistance and longer training duration, and also to result in more physiologic and reproducible gait pattern. Gait training with exoskeleton is not a common practice in rehabilitation facilities in Saudi Arabia. So what we wanted to do in our paper is, first of all, to look at the impact of intensive gait training with exoskeleton on overground walking functions in individuals with spinal cord injury, and also to look at its feasibility and safety to be practiced in day-to-day clinical environment. So we had two subjects with chronic spinal cord injury. One of the subjects had an HSC L1 spinal cord injury, and he walked with 2 elbow crutches and bilateral AFOs indoors. The second subject was diagnosed with HB T12 spinal cord injury, and he walked with a wheeled walker and bilateral KFOs. Both subjects used the wheelchair as a mode of locomotion for outdoor mobility. So what we did with these subjects is that they received 5 sessions per week for a total of 12 weeks. The duration of the session was 60 minutes, and that included the donning and doffing time of the exoskeleton, in addition to the gait training over a treadmill. Subjects were trained over a treadmill, and they were attached to a lifter or a hoist for safety under continuous supervision of a physical therapist. This is one of the subjects walking with the exoskeleton over a treadmill. We collected 2 sets of outcome measures. The first one was taken while the subjects wore the exoskeleton walking over the treadmill, and those were the walking distance, the walking speed, and the walking time. The second set of outcome measures were collected while the subject walked over ground, not wearing the exoskeleton. And these were the 10-meter walk test, the timed up and go, the 6-minute walk test, and the walking index for spinal cord injury. Both subjects were not involved in any training regimen during the time of our study. Now, this is the results for the functional outcome measures. Those were collected while the subject walked over ground, not wearing the exoskeleton. So our subjects showed significant improvement in the top left corner for the timed up and go. They also showed significant improvement for the 6-minute walk test. Only one subject showed improvement in the 10-meter walk test, while the other subject showed actually some deterioration in the 10-meter walk test, and I will explain later. None of our subjects showed any improvement in the walking index for SCI. Both subjects showed significant improvement in the treadmill-associated data, and these were the walking distance, the walking time, and the walking speed over the treadmill. Now, remember I said that one of the subjects showed deterioration in the 10-meter walk test. Now, the 10-meter walk test is basically measuring the time the subject needs to walk a distance of 10 meters in seconds. So in the first video, you see the subject walking initially with a wheeled walker and bilateral KFOs. That was before the intervention. And he was acclimated and used to this kind of pattern. Now, after the intervention, the same subject now is walking with bilateral elbow crutches, and we were able to remove one of the KFOs and replace it with an AFO. And that was the first time he walked with this kind of assistive devices and orthosis. So that might explain why he got slower compared to before. And hopefully with more training, he will regain his gait speed, or actually he could walk a little bit faster. When it comes to feasibility and safety, the donning time for the exoskeleton took 10 to 15 minutes, and the doffing time took 5 to 10 minutes. That left us with 35 to 45 minutes of pure training of gait on the treadmill. We only needed one therapist to administer the intervention. Now, if you look at the picture, this is what we typically do in the clinic when we want to do body weight supported treadmill. You need at least 2 clinicians to be working with the patient, and their job is basically to move the limb forward alternatively. One will move the right and one will move the left. And sometimes we need a 3rd clinician to stabilize the trunk or help with weight shifting activities, and maybe a 4th clinician to control the treadmill and to control the software. With the exoskeleton, we only needed one therapist, and as you saw in the videos, there was no one walking with the patient. The patient was walking by himself over the treadmill. Now, none of our subjects reported any adverse events or effects during the training or after the training. So in conclusion, gait training with exoskeleton may improve overground functional activities for individuals with spinal cord injury, and is also safe and feasible to be used in day-to-day clinical practice. Thanks so much.